Hello everyone, and thank you for viewing my presentation on a data analysis of Idaho and Utah. First, I chose to compare the national average rates of emergency room visits for acute myocardial infarctions. I used the Agency for Healthcare Research and Quality's website to create my analysis. With thanks to the Healthcare Cost and Utilization Project, I was able to create this graph to show how rates of emergency room visits due to acute myocardial infarction are decreasing since 2006. However, from the year 2013, rates have slightly begun to increase. I chose to compare the national averages to the number of visits for the state of Utah. This graph actually shows that rates have been steadily decreasing, with the exception of the year 2006, where they saw an astonishing 116 patients with acute myocardial infarctions. There's also a spike in 2004 with 112 patients seen. I chose to research acute myocardial infarctions as they are the leading cause of readmissions for our sister facility in Utah. I wanted to take a closer look to see how many patients were seen overall to see if there could have been any potential skew in the data. However, with these two charts, I don't see any reason to be concerned. This slide shows the national readmission rates by state, with South Dakota experiencing the smallest amount of readmissions and Massachusetts experiencing the highest. Interestingly, I live in Idaho, which experiences the second fewest readmissions nationally. Utah, which is where our sister facility is located, experiences readmissions at a rate higher than Idaho, but the difference is only by a small percentage. The numbers to the right of the graph are indicating which states are receiving payment reductions, with any number greater than 1 receiving them. Both Idaho and Utah are not receiving payment reductions as their readmission ratios are less than 1. This graph is showing how Idaho and Utah differ on their rates of readmissions. Both Idaho and Utah experience a higher level of readmission due to hip and knee surgeries. However, Idaho experiences fewer readmissions from the conditions acute myocardial infarctions, CABGs, COPD, heart failure, hip and knee complications, and peripheral neuropathy when compared to Utah, except for in the case of CABGs. Idaho sees almost double the readmission for CABG patients when compared to Utah. I wonder if this comes from the fact that only 4 facilities in the state can perform these, with IRMAC, the facility I work for, switching providers who were able to perform this procedure around the year 2014. It would be interesting to see those statistics at a later time. Speaking of IRMAC, this graph shows a comparison of IRMAC's readmission ratios when compared to the University of Utah, or U of U. I chose to compare these two hospitals as I currently work for IRMAC, and U of U is our sister hospital. Whenever we have a patient who is too critically ill to be managed in our ICU, we fly them to this university. Anyway, this graph shows that IRMAC experiences a higher level of readmission due to hip and knee complications when compared to the University of Utah. While hip and knee were the leading cause of readmission statewide, the University of Utah sees a higher level of readmission from acute myocardial infarctions. The University of Utah does not receive a payment reduction for their level of readmission, however. IRMAC does receive a payment reduction for readmissions resulting from hip and knee complications and coronary artery bypass graft complications, or CABGs. This is fitting if these readmissions resulting from a change in provider practice. This chart shows the National Hospital-Acquired Condition Scores, which basically shows how often a patient receives a preventable condition by being in a hospital as compared to the average score for all hospitals in the nation. Negative numbers indicate that states are experiencing HAC rates lower than the national average, where numbers in the positive indicate states are experiencing HAC rates higher than the national average, with Rhode Island being the state experiencing the highest rates and Hawaii experiencing the lowest rates. Yet again, Idaho experiences the second lowest rates and typically does not have Medicare reimbursement rate reductions. Utah also has low HAC rates, but is statistically significant when compared to Idaho. This graph takes a closer look at what conditions are being calculated into the HAC scores of Idaho and Utah. In Utah, patients are experiencing a high rate of catheter-acquired urinary tract infections and surgical site infections when compared to Idaho. Idaho also struggles with surgical site infections, but at a rate at least half of that of Utah. For the most part, Idaho is below the national average of hospital-acquired conditions, with the exception of these surgical site infections and a small amount of C. diff inoculations. This chart is a little hard to read, but this is showing the reduction rates of IRMAC as compared to the University of Utah. As stated before, numbers in the negative are below national average, indicating that the hospital is performing better than expected, and positive numbers indicate the hospital is performing worse than expected. While the previous chart would lead us to believe that there are few cases of CODIs in Idaho, IRMAC is experiencing a significant amount, especially in comparison to Utah. At this time, there isn't a payment reduction from Medicaid, but CODIs remain a high area of concern for our hospital. We recently went to a fully free ER, and ICU now has a policy in place to remove catheters in our patients if there isn't a need to monitor like intake and output strictly. Hopefully, we will see a reduction in these numbers with these policies in place. University of Utah experiences a modest amount of surgical site infections, but for the most part, this hospital has fewer hospital-acquired infections when compared to IRMAC. It appears that IRMAC is also struggling with C. diff infection rates as well. We've also changed our policy to only test for C. diff if the patient meets strict criteria to test. Otherwise, the physician has to give clear instructions to the lab as for why they're performing the test. While these high rates are not resulting in Medicare reductions, our hospital is ever vigilant on decreasing these rates. Utah is experiencing a modest rate of surgical site infections, but these rates are fairly low. For the most part, Utah is right about national average when it comes to hospital-acquired conditions. It was very interesting to compare the data sets between Idaho and Utah, and it will be interesting to see how these statistics change over the years. Hopefully, IRMAC will continue to decrease our rates of hospital-acquired infections and readmissions to keep us as one of the lowest states in the nation. Thank you for attending my presentation, and we'll talk again soon.